The NeoMono trial is a Phase II trial, neoadjuvant therapy trial in triple-negative breast cancer. And the rationale were data, on one hand, on immunotherapy in triple-negative breast cancer overall, like the KEYNOTE-522 trial, with a much better PCR rate and also event-free survival rate than with chemotherapy alone in triple-negative breast cancer. But we also looked at smaller trials like the GeparNuevo trial, and there, in an exploratory analysis, patients with a immunotherapy window before start of chemotherapy had a better PCR rate. And we tried to reproduce that prospectively in our trial. So basically the trial had no real control arm, because at the time when they started the trial, immunotherapy was not approved in Europe for triple-negative breast cancer. So in one arm, patients received Atezolizumab and neoadjuvant chemotherapy with carboplatin paclitaxel followed by EC. And in the other arm, they received basically the same therapy, but preceded by a 2-week immunotherapy window before the start of that combination therapy. We plan to include 458 patients with triple-negative breast cancer, patients meaning male and female patients, and triple-negative defined as ER/PR below 10%. So we also included triple-negative-like cancer patients. We did not, PD-L1 status was not a question, was not an inclusion criterion, but of course we did it. At the first, what we presented here is the first interim analysis of that trial after the first 100 PCR events, in both arms 50. In the primary endpoint, actually we did not really see a difference, at least not favoring the mono window arm, and we had this is pre-specified decision criterion that meant if the chance of reaching the primary endpoint was below 2.5% at the interim analysis, we would stop recruiting, but still going on with patients on trial. And because our recruitment was so much faster than we thought, we had of the 458 patients, we had 436 already recruited at the time of the interim analysis. So the primary endpoint was not met in that analysis, but the reason I think we believe we were picked here for poster discussion was that we did exploratory analysis, and in the group of patients with PD-L1 IC positive status, the PCR rate in the window group was 100%. So that is the highest PCR rate ever presented in a neoadjuvant trial for triple-negative breast cancer. Of course, in a small interim analysis, and we are cautious in interpreting this too widely, but still we believe it definitely justifies planning a second trial, including only PD-L1 positive patients, and then looking at the window again. And we believe that we can maybe reach PCR rates over 80 or 90% in that. The next analysis will be the final analysis we have 4 interim analyses planned. We're not going to perform the next 3 because we are not recruiting anymore. So actually what we're doing now is we will look at the primary endpoint PCR in the different subgroups and in the whole study. And this will be, we believe this will be done in time to be able to submit for ASCO.